You know, the primary purpose of rural healthcare is to provide excellent care to your communities. We want to provide top-notch and we call patient-centered care. So we try to work with our community and with our patients to provide the care that they absolutely need to provide a happy lifestyle, a happy environment, an environment where they are able to be the healthiest they can be.
One thing I enjoy about my job is building the relationships with my patients. Building those relationships, they truly do become your family. Having those relationships with your patient and your staff makes work enjoyable and makes it a fun environment to be in.
We're fortunate here at Heart of America to have an expansive rehab and wellness center. We have like 2,500 square feet, lots of equipment, lots of treatment rooms, lots of space for therapists to work. Specifically with the amount of therapists that we have and the high volume of patients that we see, it's kind of a great environment to really excel, not only professionally, but for our patients. We have physical therapy, occupational therapy, cardiac and pulmonary rehab, as well as speech therapy, and then wellness services, so personal training, athlete training, and some of that's all year round now that we've been able to offer. We do offer more services than probably some physical therapy and occupational therapies as far as like women's health or pelvic health. We do a lot more pediatrics than the surrounding areas do as far as a team approach.
With the focus at Heart of America Medical Center, we work very closely with the community, we work very closely with our staff to make sure that we are providing care that is needed. So we will do things outside the norm at times, like providing chemotherapy in the rural areas, because these are needs of our patients. That's patient-centered care.
We do chemotherapies, immunotherapies, telemedicine visits with the all-true oncologists, and we can do their labs, scans, all things like that. So telemedicine involves all specialties from all-true, cardiology, oncology, urology, and they collab with us to make sure the patients can not have to travel so far.
As a radiology tech in Rugby, I think we get the chance to learn more modalities. So you get to train in everything. You don't have to specialize in just one area. We got a lot of new equipment, a new x-ray room, new CT scanner, new MRI, new ultrasound. We're getting a lot of new things and it's a very exciting time to be working at HAMC.
At the clinic, we provide services for all ages, from the infant range all the way up to geriatrics. We can do pretty much anything from chronic care to acute illnesses. We also provide prenatal care, anywhere up to 32 to 34 weeks gestation, and after that, then we transfer them to their OB. We as a clinic can provide injections to shoulders, knees, hips. Some of the more extensive injections are done by the pain clinic, which we do have here in Rugby.
I think HAMC offers the best of rural healthcare. We have top-notch professionals. We have professionals that take their jobs very seriously and do a wonderful job. They're very connected to their patients. They work hard to make sure that the care they provided is done right and completed on time. And so I think they should come here for the expectation of the very best care possible.
Our main priority at the Living Center here at HAMC is to provide quality care for our patients. We want to make sure we are keeping them stimulated through activities such as bingo, we do baking, we do outings, pontoon rides. In the summertime, they go to music in the park, encouraging families to participate in activities with the patients. We have a beautiful gazebo area outside where the residents can garden and do flowers.
The people that you are around is what really makes or breaks whether you truly enjoy your job or not. And we have such a great group of people here in Rugby that you can't imagine there's a better working environment.
I think working at HAMC allows us as providers and a community, as we are a nonprofit organization, it allows the community to have a say in their health care. And that's very important to us, to allow us to give back to our community needs.
We have a great group in the surgery department. This is probably the best group of people I've ever worked with. Anybody who comes here and has some sort of surgical procedure, I think we as surgeons interact with the patients on a very personal level. Our anesthesia department is very good at making you feel comfortable about what they're going to be doing. And our nurses are just top-notch. They make you feel at ease, they make you feel comfortable.
We're fortunate here at HAMC to have our own daycare that's very affordable. My kids have been there for 5 years now, and we've enjoyed, every process along the way. They've had great staff. It's a center style, so that's kind of promotes that preschool learning.
We have a very good school system. The school systems have done a very good job of preparing my kids for the next level, whether it's university level or other careers. So the school systems are excellent. There's activities for the kids to be involved in, not just the sporting activities, but activities whether it's music, acting, or playwright. There's lots of groups, whether there's church groups, civic groups, there's activities, music in the park that we do. There's so many things in Rugby as a small community, just that'll make your family experience more full and really develop a strong family. It creates this whole family environment. It's family friendly, and so I think for young families, I think this is an ideal community to raise your kids and assure they're raised in an environment that is not only safe but also will nurture them into adulthood to make them healthy adults and be ready and willing to serve the next generation.
Heart of America kind of feels like a family. I think that's a good atmosphere of people that truly care about each other while also caring about their jobs.
This has helped to cultivate this environment of providing excellent health care in rural North Dakota. It's something that we aim to sustain, something we want to continue to grow and provide. And so in doing that, we are aiming to fulfill this mission to this community. And I think we are doing so in a way that is family-centered, family-focused, and in a way that brings together the community as one